Nursing ethics is a branch of applied ethics that concerns itself with activities in the field of nursing. Nursing ethics shares many principles with medical ethics, such as beneficence, non-maleficence and respect for autonomy. It can be distinguished by its emphasis on relationships, human dignity and collaborative care. Development of subject. The nature of nursing means that nursing ethics tends to examine the ethics of caring rather than curing by exploring the everyday interaction between the nurse and the person in care. Early work to define ethics in nursing focused more on the virtues that would make a good nurse, which historically included loyalty to the physician, rather than the focus being on nurses' conduct in relation to the person in the nurse's care. However, recently, the ethics of nursing has also shifted more towards the nurse's obligation to respect the human rights of the patient, and this is reflected in a number of professional codes for nurses. For example, this is made explicit in the latest code from the International Council of Nurses. Distinctive nature. Although much of nursing ethics can appear similar to medical ethics, there are some factors that differentiate it. Briar Mackey suggests that nurses' focus on care and nurture, rather than cure of illness, results in a distinctive ethics. Furthermore, nursing ethics emphasizes the ethics of everyday practice rather than moral dilemmas. Nursing ethics is more concerned with developing the caring relationship than broader principles, such as beneficence and justice. For example, a concern to promote beneficence may be expressed in traditional medical ethics by the exercise of paternalism, where the health professional makes a decision based upon a perspective of acting in the patient's best interests. However, it is argued by some that this approach acts against person-centered values found in nursing ethics. The distinction can be examined from different theoretical angles. Despite the move toward more deontological themes by some, there continues to be an interest in virtue ethics in nursing ethics and some support for an ethic of care. This is considered by its advocates to emphasize relationships over abstract principles and therefore to reflect the caring relationship in nursing more accurately than other ethical views. Themes that emphasize the dignity of the patient by promoting a respectful and caring attitude from nurses are also commonly seen. Some themes in nursing ethics. Nurses seek to defend the dignity of those in their care. Being able to respond to the vulnerability of patients in a way that provides dignifying care is a key concept in the field. In terms of standard ethical theory, respecting dignity can also be aligned with having a respect for people and their autonomous choices. People are then enabled to make decisions about their own treatment. Amongst other things, this grounds the practice of informed consent that should be respected by the nurse. Although much of the debate lies in the discussion of cases where people are unable to make choices about their own treatment due to being incapacitated or having a mental illness that affects their judgment. A suggested way to maintain autonomy is for the person to write an advance directive, outlining how they wish to be treated in the event of them not being able to make an informed choice, thus avoiding unwarranted paternalism. Another theme is confidentiality, and this is an important principle in many nursing ethical codes. This is where information about the person is only shared with others after permission of the person, unless it is felt that the information must be shared to comply with a higher duty such as preserving life. Related to information giving is the debate relating to truth-telling in interactions with the person in care. There is a balance between people having the information required to make an autonomous decision and, on the other hand, not being unnecessarily distressed by the truth. Generally, the balance is in favor of truth-telling due to respect for autonomy, but sometimes people will ask not to be told, or may lack the capacity to understand the implications. Finally, the role of empirical ethics has become prominent in recent years. By giving consideration to the themes above, the nurse can endeavor to practice in an ethical way. Unfortunately, this key outcome in nursing practice is sometimes challenged by resource, policy or environmental constraints in the practice area, which can lead to moral distress. See also: bioethics, bullying in nursing, clinical governance, healthcare, human experimentation in the United States, medical ethics, patient advocacy, philosophy of healthcare. References: Hunt, G. Craigie, ed. Routledge Encyclopedia of Philosophy 7. London. Routledge pages 56 euro 57. ISBN 978-0-415-18712-1. ABCD Storch, J.L. Ethics in Nursing Practice. In Hughes H. and Singer P.A. Companion to Bioethics. Chichester, UK, Blackwell's pages 551 euro 562. ISBN 9781405163316. McHale, J. and Gallagher, A. Nursing and Human Rights. Butterworth Heinemann. ISBN 0-7506-5292-6. The ICN Code of Ethics for Nurses. International Council of Nurses. 2006. Retrieved June 27, 2009. Breriamaki, Sarah. Medical Ethics and Nursing Ethics, Is There Really Any Difference? Gastroenterology Nursing 29, 182 euro 3. Retrieved February 2, 2012. Abitschudin, Verena. Ethics in Nursing, The Caring Relationship. Edinburgh, Butterworth Heinemann. ISBN 978-0-7506-5265-0. ABC Rumbold, G. Ethics in Nursing Practice. Bailey et Tyndall. ISBN 0-7020-2312-4. Armstrong, Alan. Nursing Ethics, A Virtue-Based Approach. Palgrave Macmillan. ISBN 978-0-230-50688-6. ALll, Gallagher A. and Wainwright P. Defending Dignity. Royal College of Nursing. A.B. Gastmans, C. Dignity Enhancing Nursing Care, A Foundational Ethical Framework. Nursing Ethics 20, 142 euro 149 doi, 10.1177/0969733012473772. Tuckett, A Truth-Telling in Clinical Practicing the Arguments for and Against, A Review of the Literature. Nursing Ethics 11, 500 euro 513 doi, 10.1191/0969733004 NE 7280. PMID 15362359. External links: International Centre for Nursing Ethics, University of Surrey, UK, Nurses and Human Rights from Amnesty International.